In India, 70% of the population lives in rural areas and has no or limited access to hospitals and clinics. Consequently, the rural population mostly relies on government healthcare facilities. A joint study by the World Health Organization and the World Bank recently noted that without access to electricity, many life-saving interventions cannot be undertaken. This, in turn, triples the overall services delivery of these health centers. Despite having all medical equipment and necessary staff at their disposal, solar energy can accommodate these requirements through large capacity PV systems and is fast emerging as a viable solution for decentralized, renewable and sustainable energy needs, especially in the healthcare sector, which requires 24/7 uninterrupted electricity. Decentralized renewable energy is a system that uses renewable energy to generate, store and distribute power in a localized way, and it can play a significant role in making healthcare affordable and accessible while being energy efficient. Selco Foundation has pioneered the delivery of sustainable energy to the poor in India in a manner that strengthens existing systems by making it more reliable, accessible and acceptable. The Ministry of Health and Family Welfare and the National Health Mission, in partnership with Crypto Relief and H.T. Parekh Foundation and with Selco Foundation as a key implementing agency, has solar-powered healthcare facilities that aim to bring sustainable energy solutions to address the key challenges in the health centers.
Selco Foundation has come forward and decided to help us in a few of the key social parameters. The most important thing which they have done here today, as is what I would like to highlight as a doctor myself, is their contribution in the health sector. They have ensured that the people find it more conducive to come to these places, and there is a continuous supply of electricity and there are no interruptions in power supply. Now this again has helped us perform better, in the sense people do not move away from the health center stating lack of electricity, because many of the sub-centers, even though the PHCs might be equipped with generators, the sub-centers are not equipped with generators. So this multiplier effect on the health delivery systems. Now all the sub-centers are where staff are available and people are going there to get many of their ailments sorted out. So that has helped reduce the load on the CHCs as well as the PHCs. For primary health centers and above, they have also provided water pumps and water heaters. So this again ensures that there is a continuous supply of hot water, thus reducing the cost of heating charges and bringing down the electricity requirements in all the PHCs.
The sustainable energy-led interventions would strengthen immunization, maternal and childcare, as well as basic diagnostics and critical care, decentralized renewable energy solutions and energy-efficient equipment. The organization has long-term expansion plan in the pipeline and aims at reaching 25,000 health centers across India in the next 5 years.
One of the crucial things that we realized is that without access to water and without water heating, basic things like well-being of the staff, doing deliveries, sterilizing equipments, these were things which were very difficult to do if we don't have water and water access at a public health infrastructure level. So what's happening right now is the partnership with Crypto and with H.T. Parekh Foundation has allowed us to look at health centers much more holistically, where we're able to provide not only energy for basic healthcare as well as critical medical equipments, but also for water access and water heating. And this has impacts at 3 levels, right? Either you're looking at impacts at an end user level that are using the health center, who actually have services more reliably, but also new services that are able to be rolled out at a health center level. You have impacts at the health center itself. So your staff that is there at the health center level that provides these services have much better well-being, have much better retention rates through these solutions. And the third and the most critical is the savings on cost per patient for the government itself. because these services, if they're provided in a reliable manner and staff and end users don't have to struggle for something as simple as energy provision, it goes a long way in making sure that health outcomes are improved over time.
In many rural areas, home deliveries are preferred due to lack of obstetric facilities, continuous supply of hot water, and uninterrupted power supply in public health centers.
ಈ ಸೋಲಾರ್ ಸಿಸ್ಟಮ್ಮು ಪ್ರತಿಯೊಂದು ಆರೋಗ್ಯ ಕೇಂದ್ರಗಳಿಗೆ ಅಳವಡಿಸಿರೋದ್ರಿಂದ ಎಲ್ಲ ರೀತಿಯಾದ ತುರ್ತು ಚಿಕಿತ್ಸಾ ಸಂದರ್ಭದಲ್ಲಿ ನಮಗೆ ಸಹಾಯ ಆಗ್ತಾ ಇದೆ.
Maternal health care remains a major challenge for the public health system, especially in rural areas.
ಸೆಲ್ಕೋ ಅವರು ಇನ್ಸ್ಟಾಲ್ ಮಾಡಿರೋದ್ರಿಂದ 24/7 ಪವರ್ ಕಟ್ ಇಲ್ಲದೇ ನಮ್ಮ ಆರೋಗ್ಯ ಕೇಂದ್ರಗಳಲ್ಲಿ ಹೆರಿಗೆ ವ್ಯವಸ್ಥೆ ಸುವ್ಯವಸ್ಥಿತವಾಗಿ ನಡೀತಾ ಇದೆ.
A lot of the solutions that are being deployed on the field have been co-designed with government and local stakeholders, and hopefully can go a long way in strengthening overall health services in the public health system.
ಅದರಿಂದ ತುಂಬ ಉಪಯೋಗ ಆಗಿದೆ. ಏನಕ್ಕಂದರೆ ಡೆಲಿವರಿ ಅವರು ಒಂದು ತಿಂಗಳಿಗೆ ಒಂದು 10ರಿಂದ 15 ಡೆಲಿವರಿ ಆಗುತ್ತೆ. ಒ ಪಿ ಡಿ ಇರ್ತಾರೆ, ನೈಟಲ್ಲಿ ಐ ಪಿ ಡಿ ಇರ್ತಾರೆ, ಅವರಿಗೂ ತುಂಬ ಅನುಕೂಲ ಆಗಿದೆ. ಫ್ಯಾನು, ಲೈಟ್ಸು, ಬಿಸಿ ನೀರು ಎಲ್ಲ ಕಡೆನೂ ಬರ್ತಾ ಇದೆ ನಮಗೆ. ಡೆಲಿವರಿ ರೂಮು ಡೆಲಿವರೀಸ್ ಆಗುತ್ತೆ. ಮೇನ್ ಬಂದ್ಬಿಟ್ಟು ವ್ಯಾಕ್ಸಿನ್ ಹಾಳಾಗ್ತಾ ಇಲ್ಲ ನಮಗೆ.
These solutions are universal in applicability and easy in adaptability.
నేను వచ్చి 4 రోజులైంది. ఇక్కడ అన్నీ బాగుండాయి. కరెంట్ ఉంది, ఉడుకు నీళ్ళు ఉన్నాయి, సోలార్ ఉంది, బాగుంది. ఫ్యాన్లు తిరుగుతున్నాయి, లైట్లు ఉన్నాయి. 4 రోజుల నుంచి మాకేమి ಇಬ್ಬಂದಿ లేదు. ಈಗ ಸೋಲಾರ್ ಇರೋದ್ರಿಂದ ನಮಗೇನು ತೊಂದರೆ ಇಲ್ಲ ಸರ್. ಫ್ಯಾನ್ ಬಂದಾಗಿಲ್ಲ, ನೀರು ಯಾವಾಗಲೂ ಇರುತ್ತೆ, ಕರೆಂಟ್ ಇದೆ.